I'm Crystal Sparks here at Scientific Sessions, where we couldn't go the whole week without interviewing Dr. Blood. Dr. Blood is here. He's a cardiologist with Mass General Brigham. So tell me, I know you're a cardiologist. I know your name is Dr. Blood, which may sound a little scary to some people, but tell me about what you actually do and why it's important.
Thanks so much. As you mentioned, I'm a cardiologist at Mass General Brigham. My group works in implementation science across the cardiometabolic domain. So things like hypertension, hyperlipidemia, obesity, heart failure. We build teams that help to care for these chronic diseases as part of a collaborative approach. We build pharmacist-led as well as clinician and health coach-led teams so that we can manage these chronic diseases in a scalable approach remotely without the need for patient visits or in-person appointments.
Wow. Talk about work from home benefits.
Yeah, I think it's easier for patients. It's sometimes easier for providers, depending upon where they're located. But what we like to do is build these interventions so that patients can get on guideline-directed medical therapy, lower their cardiovascular risk, and improve their health, whether that's through hypertension, cholesterol, their weight, or things like heart failure. There's a lot of medications that are known to be helpful. There's a big implementation gap in between who we know are taking those and prescribe those medications and who we think would benefit from them from the perspective of the guidelines.
Wow, okay. So you're here at Scientific Sessions this week. I want to know what you are most excited about learning or hearing about this week.
The Innovation Pavilion is fantastic, so there's not a lot that's not high quality content there. I'm learning a lot, so many great speakers, such great sessions. The late breakers this year are amazing. Select presented out this morning as somebody who works in obesity and cardiometabolic disease, secondary prevention and people who are overweight or obese, really high interest area for me. I think what we're learning is that there's a lot more that can be done to help prevent and treat cardiovascular disease. So I'm really excited to see all the posters, the sessions, and learn about how we can overcome these barriers that are facing our patients and providers.
I'm going to assume this is not your first scientific session.
This is not my first scientific session. Thanks, good guess.
Why do you keep coming back?
My colleagues, learning how to better care for my patients, the exciting late-breaking science. There's just so much good stuff. Why would you not come back?
Awesome, thank you so much. Why would you not come back? I can't wait to come back, and I'm still here right now. From the Scientific Sessions, I'm Crystal Sparks.